Very good afternoon to all. Today topic we are going to discuss about the Rajaswala Charya. Almost all the topics are completed, so now the revision class going on. Regularly, you will get the recorded session of the revision classes. If a student is having any doubt regarding any topic, they can mention in the group, so I can conduct different classes for you. Regarding the this assignment, I think you all read about your topics. आप सबने अपने अपने टॉपिक्स को चूज कर लिया है.
Ma'am,
Team is submitted. Yes, yes, yes,
Namaste, ma'am.
yes, sir. Yeah, Namaskar.
Are those the same topics for 1 year course also for first year? We have
Yes,
joined for 1 year
yeah, yeah. The
course.
topics, yes, yes. The topics is shared to you. That is for both of the students. Just I mentioned that the first year के students हैं, they have to mention on the basics of this topics regarding the things. But the student of the second year, they have to mention about the all the concept according to the patients, just like a research topic they have to submit. And today
Okay.
topic we are going to discuss about Rajaswala Charya. So on the behalf of the thesis only, I am going to explain you about the Rajaswala Charya, because when the patient is comes to you with a different diseases, जब हम उसका प्रैक्टिकल से जब आप उसका क्लिनिकली इन्वेस्टिगेशन करवाते हैं, देन समटाइम यू आर गेटिंग द पेशेंट ऑफ पीसीओएस या फाइब्रॉइड के पेशेंट्स में, जब वी हैव टू टेक द हिस्ट्री सिंस अ मेनार्ड स्टेज, then you will get the idea the patient is suffering with the disease due to unknown reason of natural nidan parivarjana, what they are doing in their regular day-to-day life. So Rajaswala Paricharya is mentioned in Charak Samhita, Astang, Hridaya, Kashyapa Samhita also. So Rajaswala Paricharya is Ayurvedic recognition of the menstruation cycle. What we have to and what we don't do. This is a very important topic to understand for the each doctor. They can implement with their patients and give the better result to the patients. Just like in menstruation dysfunctions, there is a risk of many disease. When you explain to the patient about the Rajaswala Paricharya, there is a lot of topics are also mentioned under the research regarding the Rajaswala Charya. So we have to promote this Charya, like a WHO, UNICEF, all this organization is also working for giving the important and improvement of the reproductive health in the adolescent girls and support the essence wash facilities. Just like they are awareing all the society regarding the napkins, which type of the napkins can be used, and some of the organization they are promoting the regular washing, regular time period of the menstruation, what they have to do or not to do. But in Ayurveda, it is a science जहाँ पे ये already सब चीजें mention है. But in the day-to-day life, some we can also see, being as a doctor, Ayurveda physician, we are also missing this topic. We are not practicing this topic. Even our day-to-day life, we are also not focused on this paricharya, because when you are studying from the Charak Samhita, it's mentioned that don't wash head, don't take this type of the food, don't take food in a cracked vessels. So sometimes you are feeling it's a very boring type of topic and no use of this. But regarding the this approachability in the Ayurveda field, when we are going to hire the general people regarding the small things mentioned in the Ayurveda literature, then it will give the very better results for the females who are suffering with the many diseases related to the menstruation cycle. So, if there is the main aim of this Rajaswala Charya, we have to promote to balancing the three doshas, Vata, Pitta, Kapha, and preventing the ama. and restore the energy, that is the ojas and the agni of the females. So first of all, we have to correct the positive outlook towards the menstruation. In a Rajaspala Charya Paricharya, it is important in practice them, the girls may be benefit for it, and it is a responding approach appropriately to the physical and physiological changes and occur during the menstruation as well as by the experience few symptoms. So, why it is required to understand the Rajaswala Charya, and we have to promote to the patients also, because when the female is suffering with the many diseases, just like a leukorrhea, fibroid, PCOS, dysfunction uterine bleeding, so it's a very common cause. If they are not following the Rajaswala Paricharya, so they can lead to dysfunction uterine bleeding, maybe oligomenorrhea, such conditions. So in that condition, first of all, the God gives a very important role to the history. So it's also mentioned in our literature, just like in s.r.a.f, it's also mentioned that the normal menstruation is defined as when there is a not associated with any pain or burning sensation. So if female is coming to us with having a complaint of burning sensation during the menstruation cycle, and the blood is excessive, or sometimes there is a scanty blood, not having much bleeding, and not the blood is very scanty or excessive in amount, then we have to check the color of the blood resembling to the red juice or rabbit blood. So this normal menstruation occur when it is the three dosha existing in a proper balance. So in that condition, what we have to ask the patient, if we are going to take the menstruation history, we have to ask the pain first. There is a dysmenorrhea or not. If the patient is having a no pain, no burning sensation, there is a very scanty menstruation, it's not, or amount of the bleeding is normal. That it should not be less or not be more than that. Or the color of the blood is resemble like the red juice or the rabbit blood. This menstruation occur when the three doshas in the balanced state. If one of them is imbalanced state, then it can cause the deformities in the menstruation cycle. So in that condition, we have to assess the patient के दोषा धातु का इक्विलिब्रियम, मला का एंड अग्नि का और इंद्रियों का इक्विलिब्रियम को we have to assess. तो आयुर्वेदिक सिस्टम में जब को we are take the hand of the female health care, तो वुमन हेल्थ अवेयरनेस कैंपेनिंग के अंदर भी हम अपने क्लिनिक को प्रमोट कर सकते हैं to take care of the woman health. Because sometimes patient approach to you on the diseases basis, and sometimes you promote the things like a woman health campaigning, so it will help the society also, and you will get the patient from that way also. So यहाँ पे हमें just medicines या कोई भी part हमें play करना है. First of all, we have to give the guideline to the patient, and we have give the diet chart to the patient, exercises to the patient, then only you can plan for any Ayurvedic diet. So in this guideline, we have to prevent the promotion, health, and describe the details of every stage of the woman. So regarding the Rajaswala Charya, we can communicate, we can give the awareness to the patient regarding the Rajaswala menstruation and the Ritumati, that is a fertile period, and regarding the Garbhani and the Sutika postpartum. When you conducting this awareness program nearby to your clinic, it will help you increase the patient flow in your clinic, and it will cover all the part of the female diseases. Patient comes to you regarding fertility, also regarding the city, also is the Garb Samaskar for, and then the Sutika Paricharya. So once the patient comes to you, the lady can be take many treatments under you. So we have to aware the local community regarding the Rajaswala Charya first of all. So woman is more prone to the various diseases, just like during the periods. We have to give the guideline regarding the Paricharya. So main goal of the Paricharya to give the healthy child easily and antenatal and postnatal care also. So if the patient is following this Rajaswala Charya, there is uh, Arthavyavaha Istrihi. The duration of the menstruation is regarding to the 3 to 7 days. It can't be lead more than 7 days, and it should not be less than 3 days. And that time we have to advise the do and don'ts regarding to the ahara, vihara, and mansik sthiti for the first 3 days of the menstruation cycle that can consider under the Rajaswala Charya. So in Rajaswala Paricharya, there is a lot of this published papers are also also available in the different platforms. So, according to the Acharya Charak, it has mentioned that there is a in the starting of the onset, there the 3 days and the night should be followed by the perceived abstinence. We have to guide the patient. You should not indulge in any sexual intercourses during the menstruation cycle because it can lead to aggravation of the vata, and after that, female can suffer with the many diseases. Not it in a broken vessel placed in hand. It's mentioned in the Charak Samhita. So I will explain why it is mentioned that should not wash or take bath or clean her body. It's mentioned, but nowadays for the hygiene purpose, we have to tell the patient to take a body bath. They can avoid the head bath because when they are going to throw in the water in their head, then it lead to directly pouring of the water. It can stimulate your head, and there is a if, effect. But you have to explain the patient to take the body bath to maintain the hygiene. Are Shushruta is also mentioned that there is for the first day of onset, the menstruation of the woman should not follow the they sleep, and they should sleep on the bed made of dhruva. So nowadays it's also not possible that any lady can sleep on the dhruva. We can tell them they can sleep on the hard bed. The avoid anjana, lepana, abhyangam. You should not perform any type of panchkarma procedure during the menstruation cycle. They should not cut their nails, taking too much of racing, combing, wind exercise. So in that conditions, we have to explain the patient they should not go for the full abhyangam, lepam, and anjana. They can take a body wash and apply some moisturizer in on their body. Eat that is prepared of a shali. That is a shastika shali is a high protein diet. It can be mentioned, and the meal prepared with the ghee that is lot of lubricant for the snehana purpose. The patient can add snehana, shali, and godugdha. They can also make a kheer. Godugdh के साथ rice को add करके they can make a kheer and they can take this and palm vessel made up of clay and wood. Next is about avoid food which is so spicy, salty, hot in nature. Take food in a less quantity. Always concentrated on thinking good and auspicious things. Avoid jewelry to makeup. This is also mentioned by the Acharya Vagbhata. So we can advise a patient to don't take the spicy and the salty food. They can take the food in less quantity. That means ki, how much need your body is required. You should take much bit less than that. So Rajaswala Charya is also mentioned in the scientifically way that is a Brahmacharya. Brahmacharya, they should not go for the sexual indulgence without using any type of safety, that is a condom and other thing, because it can lead to the infection can be spread. At that time, there is the os is open, so transmission of the disease is very common. Then the if the patient is going to be in contact with the person, then it can lead to the diseases like a gonorrhea. Yeah, there is a any type of the pelvic inflammation diseases. So vaginal intercourse should be avoided, and they have to wash the vagina 2 to 3 times in a day, and just like we have to explain them. Next is they should take the diet like a Shastika, Grita, and Twaka. This is a function of the barley grain is preventing chronic diseases. We have to advise the patient to take the barley grains. It is important for the bowel also and helps the metabolic syndrome, prevent heart diseases. ये accelerated wounds में help करता है आपके antioxidants की तरह काम करता है and it helps to remove the reactive oxygen spices from the cell which play a dual role on aggravating and preventing the diseases. Swastika Sali contains some amount of nitric oxide and increase the blood flow to the uterus. So many studies it's also mentioned that we have to advise the patient to take the dairy food just like a ghee, buttermilk, milk. So iski consumption when the female is taking then it has to influence the woman to reproductive health especially in the condition that involve hormonal deregulation. Some Some studies have identified associated with intake of total dairy products. It's also mentioned by some of the authors that the researchers are mentioned that if the female is taking more dairy products, just like a high proteins, so but nowadays you can see in the market there is no safe on the milk and milk products. But if you're getting a good quality of the milk, they help to reduce the diseases risk, just like endometriosis, and reduce the risk of many other diseases related to the uterus. Next, day sleep should be avoided. Here mentioned as a durva grass because the durva grass is has been shown to block the X-rays radiation in the recent medical studies. So, when the patient is used to wearing or sitting on the durva grass, it prevents the energy generating during the meditations and release into the ground. So, for that purpose, durva grass has a stunning nano particles. Uh, this nano microstructures absent from the grasses and electron microscopically and used for the examine them. So the patient, you can advise the patient to sit on the durva. They can put some durva on their bedsides also. That can also give the positive energy. So, thinking about the positive things to regulate the menstruation because all the central nervous system we have to activate and then we have to work on the progesterone and estrogen receptors. When the estrogen and progesterone receptors are the pillar of the hormones and it can be secreted from the brain. So pituitary glands. So if the patient is in the calm condition and not anxiety, they are not be aggressive, so it can help to reduce the stress level and improvement of estradiol and then rectify the psychological condition of the female and normalize the hormonal conditions. Next, we should not advise the Tikshna Ushna Amal Rasya Dravyas. You all are aware about the Tikshna Ushna Amal Rasa Dravyas can be consumption. It can lead to the increase the flow of the blood and increase the menstruation pain. Highly possibility is there after taking the hot and spicy food can lead to the this menstruation disturbance. So main thing is that the highlight the potentially protective role of increased consumption of fruits, vegetable, fishes, dairy products, and to reduce the menstruation pain. One clinical study also mentioned that the conducting of the positive between a number of times. So just like food are if the patient is taking lot of pizza, burger, chips, this is unhealthy food because if they are consuming this type of things, then it can lead to the menstruation disturbance and this. Next, physical exercise also. We have to advise the patient to consume this a guided constant pulse is no higher one in a week. To track the chemical release of the menstruation pain. So the annual just when the patient is you take for a whole year. So you have to take the of the female
Yes, ma'am.
completion of the Yes, reference regarding to the research study of the Rajaswala Paricharya. So when the patient is comes to you with the history of the dysmenorrhea, you have to take the history regarding the dietary factor. It is a very must. You should not give blindly the Shankhavati and the Shokarist, Kumari Asaf. If we are giving these type of the drugs also, that helps to reduce the spasm only. And but the female should avoid all these type of things, and they have to follow the Rajaswala Charya. So, avoiding bathing, according to the Charya Chark, it's mentioned that so bathing changes the temperature of the body, just like it can be predicted that the mutual interaction between the neural circuit and the regulate energy balance. So, the hormonal changes across the menstruation cycle is not only the directly control reproductive system in the woman, but also exert the effect of other physiological systemic changes. This effect represents the systematic approach in creating the environment conducted to implement just at the development of the embryo. So we should simply, there is a research mentioned that you should tell the patient to avoid the head bath only because it can vary the body temperature that can regulate with the hydrotherapy. So it in unbroken vessels because clay and the alkali properties. So utensils make with the clay. In the older time, there is a the people are used to take the food in the clay vessels. So that the balance of the pH balancing of the food in interaction with the food thus enhance the digestion. When the clay was mixed with water, then it can be incubate for the 24 hours with live bacteria at the body temperature. So then you have to assess the patient this is a chemical interaction to the clay with the bacteria. So other exertion, one study suggested that intense exercises has been reported to cause the luteal phase defect. Excessive exercises means that ati vyamaha. If the patient is doing 45 minutes of vyam daily, it can be considered as a normally. But during the menstruation, they should not go for that because it can lead to the luteal phase defect and oligomenorrhea and other menstruation dysfunctions and amenorrhea. Numerous studies have been demonstrated that the 32 engagements in that. So we have to tell the patient to avoid the day sleep also because day sleep it can cause the कफ का increasement होता है इससे कफ increase होगा patient का तो menstruation problems जो है वो patient की increase होगी ही. So there is also a study reference that in Rajaswala Paricharya the patient is unmarried, having a 30 years unmarried girl between the age of 18 20 for the examine. One other menstruation symptom including just like cramps hai, backache hai, leg pain hai, headache hai, pimples, breast tenderness, loss of appetite. These these all are the symptoms can be mentioned. So, if the patient is suffering with the this loss of appetite, diarrhea, constipation, vomiting, weakness, and then the studies have mentioned that the dysfunction uterine bleeding on the 25th years old female, when we are providing the Rajaswala Charya, we are having the observations regarding the they should follow the Rajaswala for the consecutive cycle of 3 to 4 months that helps to reduce the symptoms. It's there is a more than 4 research studies has been registered under the clinical trial. So this is also the one more good topic for the clinical trial. You can also promote this type of treatments in your clinics also. So this Paricharya have been mentioned for the human well-being and help the immunity power because when we are planning the patient for the diet, daily regimes, lifestyle changes, so it will help to increase the immunity boosters and increase the immunity power. Then the Rajaswala Paricharya will be help to maintain the proper at the Rajaswala phase and provide the menstruation. In this phase, when the follicle is recruited, the next cycle and the dominant follicle is choose for the 5 to 7 days. Then the in the Rajaswala Paricharya it is not followed properly, then it can lead to the Asvadosti. That is a menstruation disorder, just like a yoni vyapat, and can be corrected with the menstruation problem like dysmenorrhea, PCOS, infertility, and hence it is necessary to follow the Rajaswala Paricharya during the Rajaswala Kala. So Rajaswala Istri can be marked by the person who have undergone Shodhana procedure, who is having Agni Mandya, person having a wound like a Vranitika. So menstruation can be started monthly after the Shodhana procedure. If the patient is coming to you and having a problem of any type of these gynecological disorder, you can advise the patient to go for the Shodhana procedure. You can give the one setting of the Virechana, then that also must be very beneficial for to normalize the hormonal condition of the patient. We have to focus on the knee of